the average American watches something like 7 hours a day of like television related material. So for me, I find meditation actually saves me time. And because I fall asleep faster, for example. So there's an extra 20 minutes of my day there because I'm falling asleep about 20 minutes faster. But it also helps me make better decisions. Like I remember when I was a faculty member at McGill, I had some grants from the Canadian Institutes of Health Research, and they were important. And I was, fresh out of my postdoc junior. I was working with some really important senior researchers in the field, and I would need to send some pretty important emails and that I cared a lot about. And sometimes I'd be there and it'd be like a strong emotion, partly excitement, yes, partly feelings of anxiety. And I'd be like, okay, I'll go grab a cup of coffee and then I'll send that email. And so I'd go and get a cup of coffee, which would actually jack up my nerves even more. And I'd get back to my desk and I'll be like, okay, I'll send the email tomorrow, definitely tomorrow. And I'd just kick the can down the road. And through my meditation practice, one, I learned that coffee's not a good match for my personality. But two is, if a strong emotion comes up, can I just care for that emotion, understand its roots, care for those roots, and then do that skillful next step, which is often sending that really important email, which actually saves me time because I'm doing the most important thing, even if it's hard. And that allows me to live a bigger, fuller life that has greater impact and is a better match to who I am. So I do take, 30, 40 minutes a day to do meditation, but I think it actually is saving me time and increasing my impact because I'm making better decisions and better able to hold challenging things.
Hello, everyone. This is Dr. Al-Mashat, registered psychologist and mindfulness teacher, and founder of the Center for Mindfulness Canada in Vancouver. I'm interested in bringing conversations that support well-being, positive change, and mindful living. Today's guest is quite a treat. I feel fortunate that we've crossed paths in our mindfulness journey. So I just want to welcome you first, Dr. Eric Loucks from Brown University. So welcome to today's talk. Thank you.
Yeah, great to be here.
Thank you. I have a bio that I wanted to read just for those who are not as familiar with your work. I have to say, it barely touches on what you bring. I looked at your CV. I don't know, I didn't tell you that, but I thought, wow, 36 pages long. Like, what an incredible depth and breadth of work. So thank you for joining us today.
Yeah, my pleasure. Yeah, it's especially meaningful to join you because I spent 10 years in Vancouver and grew up in Victoria. So haven't lived over there for a long time, but it's definitely a place close to my heart.
Yes. So we're neighbors, basically.
Yeah, sort of. Opposite coast, but neighbors.
Long distance.
Yeah.
Well, thank you. Welcome. So thanks. I'm just going to read your bio, just for those who are not as familiar. So Dr. Loucks, PhD, is a professor, a researcher, and pioneer in the study of mindfulness and health. As the director of the Mindfulness Center at Brown University, he teaches mindfulness-based programs and leads high-quality, methodologically rigorous research to investigate science behind mindfulness and its impact on health and well-being. This is deeply interesting for the audience and listeners and myself, Eric, this whole area of mindfulness and the research. So I'm just going to share a couple more things. As an expert in aging-related research, he optimizes mindfulness programs to specific age groups. He's the lead developer of mindfulness-based college, MBC, mindfulness-based blood pressure reduction, MBBP, and has received numerous research grants from the National Institute of Health to evaluate effectiveness of mindfulness-based interventions, and such as mindfulness-based stress reduction, MBSR program, which some of the listeners are familiar with. You have a recent book, which I'd love to get into as we chat, which is the Mindful College Student, just released April 2022. Over the course of his career, Eric has held teaching positions at Harvard, McGill, Brown University. He's been practicing mindfulness for over 25 years. And another thing that wasn't in your bio that I find really interesting, I'd love to circle back to, is your work with Thich Nhat Hanh in terms of your ordination in the Vietnamese Zen tradition. It's a beautiful.
Thank you.
So a warm welcome to you.
Thank you. Yeah, really wonderful to be here, and look forward to connecting with the audience that you serve and with you today too.
Thank you. I wonder if we can begin way back, which is what pulled you into mindfulness yourself before getting into the practice, interest in the research. You have a long journey. So what even got you interested? Why mindfulness?
Yeah, well, growing up in Victoria, my mom's second cousin married a Tibetan named T.C. Tathong, and he became the foreign affairs minister for the Dalai Lama's government in exile when I was a kid. And he had a very unique way of being. Just he was very present and different than my family members. I mean, I have a wonderful family, of course, too.
Yes.
But he just had a very unique way of being that was curious for me. And then I started to learn about the Dalai Lama and read some of his books, and just kind of resonated with me. And so then, as I went to college and grad school, I started looking at how to live a happy, healthy life and how to help others live happy, healthy lives. But one thing that I noticed was a lot of people who I really respected in the world had a pretty strong contemplative practice, whether it was Mahatma Gandhi or Martin Luther King or Mother Teresa or Dalai Lama, or even to a certain degree like Jean Chrétien, who was Prime Minister of Canada then.
Right.
And so I was like, well, there's probably something to it. And so I started to explore different contemplative practices, and in that process, mindfulness and meditation, and in my case, Buddhism, was a good fit for my personality. And so I started to build more into my personal life at that point, particularly practicing in the tradition of Thich Nhat Hanh, who was a Vietnamese Zen master who lived in France and had a very unique way of bringing mindfulness into the world, where he wasn't looking to convert anyone to a particular religion or anything. And he was also kind of trauma sensitive too, because he lived through the Vietnam War, and had a real kind of social activist kind of side that's very applied. So it's kind of resonated with my kind of scientific kind of tendencies and interest in social action, social justice. So I ended up working with them a lot. He was very good at community building, and then that built up my personal practice. And then about 12 years ago, I was doing research on social determinants of health and seeing I really wanted to do something about them, and that there was pretty good evidence emerging about how mindfulness might be used as an intervention to help mental health, but also I'm particularly interested in physical health. And so I started to emerge into that field, and in the last 12 years have really been accelerating through that process. So that's some of the backstory.
Yes. As you're sharing that, there is such a sense of community and connection. You mentioned Thich Nhat Hanh, social justice, bringing things to the world. And sometimes there's such a misconception that mindfulness is just something we do behind doors, and it's kind of a selfish act, taking time for yourself and just sitting, trying to do nothing.
Yeah.
That's actually the opposite. It's being connected deeply. So can you say a little more about how is that connected? If someone takes time to meditate, how do we bridge that gap? There's something about connecting to ourselves, wakes us up to the world. I wonder.
Yeah. With the book that I wrote, it has a whole couple of chapters on like actually applying mindfulness practices to politics or performance in our areas of interest or that kind of thing. So it's I think mindfulness can help us become more aware of like our thoughts, emotions, physical sensations. And so whether we're a young adult or someone of just about any age, what are those thoughts, emotions telling us in terms of what's important for ourselves, but also what's important for the world?
Mm,
And so if we see certain challenges arising, whether it's climate change or wars in different regions of the world, or uh, you know, atrocities towards certain racial and ethnic groups, whether it's First Nations peoples or other people from other backgrounds, what arises, or whatever it is, what arises in our thoughts, emotions. And then a piece of mindfulness is, you know, this element of remembering. Mindfulness is often defined as, paying attention on purpose in the present moment, non-judgmentally, like, as John Kabat-Zinn
yeah.
offered a definition in that area. But another piece in the translations is this idea of remembering. And I often think of it, and was taught this, of it's like remembering to bring our wisdom into the present moment. And so
Beautiful.
wherever we got that wisdom, whether it was from our parents or books that we've read or whoever, friends, what is that wisdom sharing? So as we become aware of our thoughts and emotions around maybe what the world needs and maybe what we're most motivated, what does our wisdom share with us in terms of wise next steps? And then we can actually act on those next steps. And so that might be steps that are actually helping to make the world a happier, healthier place, for example.
Mm. So beautifully said. So there's a component of waking up to our own self and thoughts, emotions, seeing our own blind spots, and then bringing it to the world. Taking actually, it's not inaction. Mindfulness actually can bring a lot of wise action. That's the piece
Yes.
you're highlighting so beautifully. It's not disconnecting. It's actually connecting. Yeah.
Yeah, it's like, so I think of myself as like an ambivert, in between introverted and extroverted.
Yes.
So, you know, I I do well to have that alone time where
Mm,
I'm going deep into different projects or really understanding myself. And I am always connected with others, but at that moment, it's sort of like my field is narrowing into a particular project for myself. But
mm,
then I also have the extroverted side of me, which is to, I really get a lot out of connecting with others and,
mm,
helping groups do amazing things. And so I also find with mindfulness, it allows for both, that sometimes we can narrow in to go deep into a particular area, but then we can also broaden out and to really be connected with others too. And I think everyone has some of both of those in them, of course. And mindfulness can help accentuate both directions.
mm,
And so I know you're an MBSR teacher, for example, and as am I. And so, the beginning of MBSR is often pretty fundamental trainings on awareness of the body or the breath or another anchor point, and really developing those abilities to concentrate while bring in our self-awareness. And then around like week 6 or so, we start to direct those skills towards our relationship with other people. But
mm.
we allow the first 5 weeks to like lay down the foundation, because sometimes where we get most caught or most crazed is in our relationship with others. And yet it's also a place where mindfulness can be very powerful, to just notice what thoughts, emotions are arising when we engage with issues that are really important to us, whether it's another individual or climate change or whatever it is. And that can bring up strong emotions and thoughts, but they're just emotions and they're just thoughts that we don't necessarily have to act on. And so can we be, as John Kabat-Zinn shared, can we be like sewing our parachute before we need it? And so that when we jump out of the plane, we're not like sewing our parachute while we're flying through the air. So some of this mindfulness training can help us, with that resilience and that foundation, so that when we're stepping into
Mm,
issues that are so important for the world and also so tender to ourselves, that we've got that parachute really well sewn,
mm.
if mindfulness is a good fit for us.
Yeah.
And, mindfulness may not be the best fit for everyone. There's lots of paths to health and happiness, but for those of us who mindfulness and meditation is a good fit for, then it can really provide that resilience too.
Mm.
Yeah.
It's a beautiful metaphor about the parachute. Because
Mm-hmm.
sometimes I share this often how people meditate as a crisis meditation. When something goes bad in life or a challenge, and they're like, I haven't meditated for like 5 months. Let me sit and I want meditation to fix me now, the kind of crisis
Uh-huh.
meditation. And what you're
Yeah.
sharing, it's actually we're building um, skills. So I wonder if he can say a little bit about the mental health component. I know you've dived deep into the research, and I'm curious
Mm.
in terms of why is it so relevant, mindfulness, in terms of mental health? What do we now
Mm.
know in the research?
Yeah. Yeah. I mean, mental health um, is getting increasingly destigmatized, I would say. And I think the pandemic has helped with that because of the loneliness that's come from that and higher levels of anxiety and depression, for example. So that, I think there was a saying at one point during the pandemic in Spain that if you don't know anyone with COVID, you sort of don't have any friends, sort of thing, because everybody
Everyone
knew
knows
someone who had
someone.
COVID. And I would say if you don't know anyone who's suffering from anxiety symptoms or depressive symptoms or loneliness, you might not know too many people because it's so prevalent in society. Um, and if you are experiencing that yourself, knowing that you're in very good company, and so with mindfulness, it depends a little on the mental health outcome that you're interested in. It's actually pretty different for depression versus anxiety. So for someone who's working with depression symptoms, there's been a lot of research, say with mindfulness-based cognitive therapy, particularly in people that are not currently depressed but have a history of depression, and they're trying to prevent a relapse of depression. And there, it seems to be very effective. There's been a number of clinical trials. They've all been summarized into what we call like a systematic review and a meta-analysis
Yes.
that shows it outperforms even antidepressants, for example. And they've also looked at the mechanisms. And one of the mechanisms by which it seems to work is through helping with what we call like repetitive negative thinking or rumination. So that when we're experiencing depression, we can sometimes kind of get into these negative thought spirals where we can have negative thoughts that can lead to other negative thoughts, which can then lead to other negative thoughts. And mindfulness, through its ability to help us be aware of like our thoughts, emotions, physical sensations, sometimes it can help us just see, oh, I'm actually in that spiral right now. And sometimes we might feel it through a physical sensation, like, tension in the shoulders or in the chest, or, we feel stress in different ways, depending on who we are. Sometimes it might be an emotion saying, I can feel that sadness right now. And it's been there for some period of time. Or sometimes it's a thought and it's like, here I am in that thought process again.
Right.
And as Thich Nhat Hanh said, when we get into that, sometimes we can just say, hello, my little friend, you're back again. And
Right.
so here's
Yeah.
this common place that we think. And so, mindfulness can sometimes help with a self-awareness to even note that we're in that kind of negative loop, but it can also help with training us in the attention control to place our mind where we choose to place it. So that, say, if we're in a negative thought spiral, we can ask ourselves, is it helpful for me to be thinking about this? And what am I getting out of it? And we're often getting something out of it. Maybe we think that it's helpful because we're like trying to sort through it. We might get to an answer, but then at some point, all that negative thinking starts to kind of plateau off in its benefits and maybe actually cause some harm. And so in those moments, because of our training in meditation, our training in placing our mind where we choose to place it, sometimes it's on the breath or a part of the body. It's like going to the gym, and we get better at and we get stronger. And so then in those moments of repetitive negative thinking, we can use that enhanced attention control to then place our mind where our wisdom is sharing with us that it would be best placed. And so those seems to be some of the mechanisms and some of the evidence, particularly say around mindfulness and depression. And then
Mm.
around anxiety, it can actually have some different approaches there too that I'm happy to get into if it's of interest.
Yes, please. We would love to hear about that in terms of
Yeah. Okay.
mindfulness-based stress reduction. I know there's a lot of work in terms of chronic pain, but also stress, anxiety,
Yes. Yeah.
whole range.
Yeah. So, I mean, like with stress, mindfulness based stress reduction seems to be quite effective for it, which is good given it's called mindfulness based stress reduction. So, there's been,
Yes.
dozens and dozens of clinical trials and pretty consistent reductions in stress. Around anxiety, the evidence is a bit more mixed with MBSR. So, for folks that have just general anxiety symptoms. Like we all have some level of anxiety symptoms from very, very low to very, very high.
Yeah.
And if we just look at anxiety symptoms, MBSR actually does quite well compared to like what we call inactive controls, where people just aren't getting much. Maybe they're waiting to get the MBSR in the future, or they have a
Mm.
little bit of like get a pamphlet or something about health education stuff. And if you compare it to active controls where they're maybe getting cognitive behavioral therapy or some other kind of active thing, MBSR often doesn't do as well actually as other programs.
Mm.
So it's sort of like MBSR is better than nothing for anxiety, but there might be other approaches that are better, particularly if someone has a diagnosed anxiety
Mm.
disorder, for example. Um, and so I think part of it is when we have really strong emotions, anxious emotions, it can be tough, especially at the beginning, to come closer to them.
Yeah.
And and so that's where we see a lot of adapted mindfulness programs coming out. So say Judd Brewer, who I mentioned before, he's on the other side of the wall. We work
Yes.
together. So if you hear his voice, if he says something about his program, I'll put the mic at the wall so you can actually
Who's,
hear what
who's
he's going to
behind you?
say.
Yes.
Yeah. But he's developed this program called Unwinding Anxiety that's more
Yeah.
adapted specifically for people that are working with anxiety right now. And it's been shown in a couple clinical trials to be, pretty effective. Still needs some long-term follow-up and larger sample sizes and stuff, but so far so good. And he has a book called Unwinding Anxiety that I've been quite impressed with, and an app as well. And so it might be that if we can start to really create programs that meet folks where they're at, they can have even bigger effects and best suit the population that we're trying to serve. So, personally, I find with anxiety, the way Judd talks about it is sort of through a lens of habit, where if we're getting those anxious feelings, even noticing, you
Mm.
know, them there, also noticing what triggers them
Yeah.
and coming to understand it better. And even starting to see what we get out of having those anxious feelings, that there's both positive things as well as some negative things. And then starting to play around with it to see what we can do. So what happens if we shift our attention,
Mm.
when we feel those anxious feelings coming up, if they're not so useful in this moment, can we shift our attention, kind of like what I was saying with mindfulness based cognitive therapy, to a more healthy thought or a better thought in that moment that's maybe more productive, or maybe it's distracting a little bit, going for a walk or bike
Mm.
ride or having a cup of tea outside or getting into nature, whatever it is, talking with a friend. Um, and then another piece that Judd talks about is, can we start to sort of create like a bigger, better offer that when we have this trigger that comes up that can arise with anxiety,
Mm.
at some point the anxious feelings might help us in some way to like come up with a solution. But at some point, if they're plateauing off on their benefit, is there something better that we can do? Whether
Mm.
it's getting some exercise or, you know, reaching out to a therapist, reaching out to a close friend,
Mm.
and so those are some of the ways that we're seeing mindfulness being used more with anxiety itself. But it's still actually quite an emerging area
Mm.
of research right now that I think still has a ways to go to find the programs that really match it well.
Mm. Yeah. When you're sharing that, there's a sense of what you mentioned earlier, this relating to our thoughts, and even taking some wise action, getting to work with
Mm-hmm.
them in relation. Like, well, here's my thought. What is it saying? What is anxious thought? What is a depressive thought? How am I relating to it? Because it can really
Mm.
spiral when, especially if it's on the more severe range of
Yeah.
anxiety or depression. And I find that similar in terms of one-on-one work and my counseling work.
Right.
Is when it's on the more severe range, it's more challenging to turn in. And at
Hmm.
times, this is when consultation with a doctor, general practitioner, GP, looking into medication, sometimes can be really supportive. And I've seen that in the one-on-one work and even MBSR, mindfulness-based stress reduction, kind of reducing some of that high severity to a little more manageable. Then we can do the work.
Yeah. Yeah.
Um, so there's just the timing of when I found. Um,
Yeah.
yeah.
Yeah. It makes good sense. We talk about an MBSR like with the window of tolerance. So
Yes.
in noticing if we're in our comfort zone or if we're in kind of a growth zone where it might be a bit stressful, but it's kind of like the good kind of stress. They call it eustress, like EUSTRESS. And if
Yes.
we're in those ranges with mindfulness, it can be very effective. But if we get into the distress zone, which is maybe how you're sharing clinically, if there's very high levels of anxiety, if there's distress to turn inwards, that's maybe not actually the best time to be, bringing more awareness to our thoughts, emotions. It might be other things are better, like a bit of healthy distraction, you know, uh, or even some kind of behavioral shift, like whether it's, taking, medication or physical activity has been shown to be quite effective for mental health, for example, or connecting with a loved one or getting into nature. So
Mm.
again, mindfulness is sort of like knowing when when's the best time to connect in with it. And just as you shared, to bring it into where we're in that comfort zone or that growth zone, in that
Mm.
window of tolerance, where that can be where it can be really fruitful. But if we're feeling overwhelmed, it might be time to just kind of take a step back and to care for ourselves in other ways, or maybe touch in. I think that's maybe called pendulate or something, or kind of like a
Yes, the
pendulum where we
pendulum
touch
goes
in,
slowly,
we're
slowly.
like, oh wow, yeah, it's
Yeah.
strong, and then pull back up again,
Yes,
and then we
totally.
just kind of touch lightly to see where we're at, and then see what our wisdom is sharing in terms of how to best care
Yeah.
for it.
I really appreciate you naming that because sometimes there's a misconception. It's just a magic pill, mindfulness, and it's kind of. And I always share with people, well, it's one incredibly effective way to change our relationship with whatever pain, physical or emotional. But there's also timing and readiness. It may not be now. I've seen
Mm-hmm.
a lot of people that have done one-on-one work where after some amount of work that we do and others have worked with other therapists, then they're ready to do the MBSR.
Yeah.
So it's
Yeah.
not, but it doesn't mean they have to do one-on-one work before even checking out an information session about MBSR.
Right.
Lay
Yes.
out like,
Yeah.
here's what it is. It might be for you now, or may not be for you now. Maybe something else, and then when it's the right time.
Yeah.
Because otherwise, people get discouraged. Like, oh, because I am anxious, or because I have some severe trauma, this will never be for me. And
Mm-hmm.
it's more of maybe just not now. Let's just see.
Yeah. Or for the adaptations, like at Brown, we have an MBSR teacher training program, and I know you're part of the Global Mindfulness Collaborative that has a well-respected MBSR teacher training program as well. So at Brown, for example, we've just started this new course called the Ethos of Mindfulness-based
Mm.
stress reduction, and we do a deeper level of training on trauma sensitivity, for example, as well as the science of it, the contemplative underpinnings, and you know, diversity, equity, inclusion, and belonging, so that we're adapting it to, say, in the case what you were just sharing, to be trauma sensitive, so that,
Mm.
say, in the past, we might have a meditation on the breath, but for someone who's had some trauma around their breath, whether it's asthma or other things, the breath might not actually be a safe place to have an anchor point. So
Mm.
best practices around that are to offer other anchor points, other objects of meditation, like, part of the body, like say the palms of the hands or the soles of the feet, and just being there with the raw sensations of it, of warmth, coolness, moisture, dryness, touch, lack of touch.
Mm.
Or even if the body's not a place of comfort as a meditation object, to even use, say, sound or the lack of sound. And it's those raw elements of sound, like the pitch, the volume, if it's regular, irregular, how close or far it is. So that's sort of an example of trauma sensitivity that maybe even for folks who do have a trauma history, and there's actually some very nice evidence showing that mindfulness might actually be more effective for people who had early life adversity, like exposure to abuse, for example,
Mm.
because it can potentially help heal the past and the present moment. But sometimes we need to do these adaptations to be trauma sensitive. And there's a book by David Trolevin called Trauma Sensitive Mindfulness that's a very skillful way of presenting some of this work, if anyone's interested in that.
Yes. So adaptations, um, you know, as you said that, just remind me of, the older tradition, very firm traditions where just sit and don't move. Like that's all you do. And
Yeah.
that's some of the, when I began my journey, that was more of my experience. And
Mhm.
it was a struggle. It was a struggle. There were no, in MBSR, there's options. You can lie down, you can sit, you can stand, listen to your body. And I did a lot of retreats way back where just sit.
Yeah.
If your knees are shaking with pain, just observe, right?
Right.
And, just observe.
Yeah.
So
Yeah. And
adaptation.
if you're coming into that without a huge foundation and the teachers are not so available to support, how's that going to go in terms of risk of adverse events, for example? So, decent amount of research going on in adverse events of meditation right now and mindfulness, and at least what I'm seeing, at least with some of our work, MBSR, every single intervention can have adverse events, whether it's a surgery or a behavioral intervention or medication, like even just Tylenol. Look at the
Yes.
list of potential adverse events on a Tylenol package. And so with mindfulness based stress reduction can certainly have things that can arise. But
Mm.
I do find, especially increasingly as it becomes more trauma sensitive and it follows the evidence on that around adaptations, that it can really lower the risk of adverse events. And it, compared to, say, a retreat that's really pushing hard on some of the things, just like you shared, if you just kind of go in without a strong foundation, it can actually crack people open in really amazing ways, and huge
Yes.
insights can arise. It's like sort of it can be a fast route, but it's like a higher risk
Very high
in terms
risk.
of like things that you know might not go as well as you hope.
Yeah.
And so that's something that we're trying to do, including at Brown, is to study adverse events really carefully,
Mm.
so that as we develop evidence informed programs, that we're maximizing the benefit, minimizing potential harm, and also just being transparent about that, so that everyone has informed consent about what they're getting into. And same with MBSR.
Mm.
When we have the information session, that's part of the script for the
Right.
information session, is just to share about potential benefits and also potential difficult things that can arise too, so that people just have a um, you know knowledge of what they're getting into. And overall, it tends to show predominantly positive benefits at the population level, but things can arise. So we always want to be really respectful to everyone, and to do the research to see what is arising, and to report that, and to minimize the likelihood of that as much as we
Yeah.
can through our teacher training programs and offering the MBSR itself.
Mm. This deep root of research in, uh, began, I think, at UMass, University of Massachusetts Medical School, Jakob Zen, mindfulness-based stress reduction.
Mm-hmm.
Really, it's one of the things that actually kind of hooked me to this mindfulness. It's like, wait a
Mm.
minute, it doesn't just feel good, even though it has challenges, it's not easy, mind is everywhere, things come up. But actually, it's quite rooted. And that was quite remarkable what John did from the start as a scientist. Just let's keep track of what difference is this making in terms of evidence base. So I wonder if you can share a little more about that, other areas in terms of evidence based pain or other areas where MBSR or mindfulness interventions seem to be quite effective.
Yeah, sure. Yeah, I think around pain, there's a lot of real active work in that area right now. The
Mm,
National Institutes of Health, particularly the National Center for Complementary and Integrative Health,
mm,
is very supportive of research looking at the intersection of mindfulness and pain management. Um, uh, there's some researchers like Fadil Zaidan, for example, at
mm,
University of California, San Diego, that's a real leader
mm,
in this arena. That's always interesting to see his work. Um, Pain isn't my particular expertise, but I do teach a course called Meditation, Mindfulness, and Health at Brown, and pain is one of the modules. And I've looked at systematic reviews on this. And what I see anyway is that mindfulness training seems to have some benefit around helping people uh, manage their relationship with pain.
mm,
That mindfulness may not, I mean, in some instances, there's evidence that mindfulness training can lessen the pain, but where I often see the more consistent evidence is how it can help people in their relationship to
mm,
pain. Um, for example, with chronic pain, it can be almost constantly there, but actually, if we start to tune in to it, we might find there's times when there's less pain or even no pain, and times when it is there. And to savor the times when it's not there, for example. But also with the training and attention control, that we might have the pain there. Um, and can we, you know, accept it that it's just part of
mm.
reality? This
Yeah,
moment it came for whatever reasons it's come from, and it is there. And can I really be here, with my child or with my job or with my loved one or with this
mm,
particular experience, so that with the attention control, they can perhaps help people zoom in on other elements of their life rather than spending as much time, you know, thinking about the pain. Um, I think mechanistically, there is some potential there to
mm,
be able to understand like the root causes of the pain. And once we understand the root causes, sometimes solutions can arise. Uh, so, say for me, I have some scoliosis that's genetic, and so I can get back pain from that. And knowing that some of the root causes of that is one is genetics, I just can't do anything about.
yeah.
But another one is that I have a desk job, and so on the days that I start my morning with like core exercises that really strengthen my back and my abdominal muscles and the side muscles, I have less pain. And it's shifted the sports that I do so that I notice that if I'm rock climbing, swimming, and surfing, my back is pain free.
Mm,
And so I do those sports. And And so part of mindfulness can be like, okay, what are the root causes of this pain? Not blaming ourselves for it or anything like that. Non-judgmental, curious awareness. It's like we're scientists, just letting the data come in.
yeah.
And then once the data comes in, how do we respond skillfully to those data?
Mm,
And so sometimes there's behaviors that we can do, whether it's taking medication or doing yoga or doing some kind of physical activity or
mm,
seeing some kind of medical professional that can help lessen that pain. And so
mm,
that's mechanistically and theoretically some of the ways that mindfulness could help reduce pain. But
mm,
where I see some of the strongest evidence is changing our relationship to pain, that it may be there, but it's not. causing us as much distress emotionally as it might have in the past.
Mm. When you're describing it, it feels this coexisting. Mindfulness supports us in coexisting with things, some things that may not change. We're just here. How do we work with them? How do we live with them? Because something that I see often in my practice is the more we push against something, just for the more we struggle with it. Um,
Yeah.
things like panic. When people start pushing, it's like, oh, not this feeling. The panic attack gets stronger.
Mm-hmm.
The pain, the more we resist and push, I hate this, I don't want this. Of course, we don't
Yeah.
want it. But the more we push, the just more we struggle with it. So, really appreciate how you kind of named it. There is actually, it's here. For better, for worse, it's here. Now, how can I be with this?
Mm-hmm.
I feel as you described it, this applies to so many areas. It could be grief. It's not about, oh, it's fixed. It's okay, how do I live with this grief, this loss? And we've all have experienced some kind of loss.
Mm-hmm. Mm-hmm. Yeah.
Mm,
Yeah. I had an MBSR participant come into my class once with a cane and
mm,
a limp. And she shared right in the first day that she had a knee surgery that she felt had been botched by the surgeon. And she was
mm,
very upset about it and was living with chronic pain. And every day that she came in, she would talk about how upset she was about this surgery that had gone wrong.
mm.
And pretty early on with MBSR, we offer meditation that involves like a raisin, and
Yes.
we give everyone in the room this raisin, but we actually encourage them not to identify what it is conceptually, but to just be there with how it looks and how it smells and the sensations of touch and taste. And it's almost like we're looking at this object kind of from outer space or something. Like don't think too much about being a
Yeah.
raisin, but just be there with this object. And whenever we'd go on to the next thing, she would just say, it's a raisin. Like it's a raisin. Like, well, how does it look? What are you noticing? In the color, the texture.
Mm.
It's a raisin. And she was locked into, like, she couldn't get beyond that. And it actually kind of became this big insight for her that she was also looking at her knee pain through that lens of it was a botched surgery, and it
Mm,
was causing her so much pain through the inflexibility of her to just be with the pain and to respond skillfully. And over the course of the MBSR program, she started to soften around that, and actually her anger towards the surgeon lessened, and she started to see, well, there's actually other causes and conditions that could be going into my pain too, and here it is, and how do I work with that? And she started to get much more kind of like proactive and accepting of the condition, not in a docile way, but in an active way. And her suffering around it really lessened. And she began to laugh at sort of her past rigidity of the
mm,
ways of thinking and started to celebrate the flexibility in her ways of thinking, and seeing it having a bigger impact on just having more peace around her conditions of her life, kind of thing.
what a great example that you shared of really change of perspective. So something in the NDSR
Mm-hmm.
program, kind of class two, we get into. What is the perspective? What are we seeing? What are we not seeing? And sometimes it's
Yeah.
so hard because that's the perspective we hold. It's hard to see what we're not holding. So
Yeah.
that's a great example of a change in perspective. The pain is still there, large surgery is still there, but you change how she is with it and reducing the suffering with
Mm-hmm.
it. Yeah.
Yeah. Yeah. Yeah.
Something else I'm really curious about, as we're talking about these different areas that mindfulness can be of support, is often people ask, well, how long do I need to meditate? And when they find out in the mindfulness-based stress reduction program, 40 minutes, that's a lot. Can I just do 5 minutes? And I'd love to hear, you've done some writing around that as well. If you just
Mm-hmm.
share, what is the amount of time? People always look for the magical number. And obviously,
Yeah.
any practice
Yeah.
is better than nothing. At least we're practicing. But
Right.
What
Right.
creates
Yeah.
the difference on a brain level, on
Yeah.
a body level?
Mm. Yeah, I remember you reaching out to me about a year ago asking about evidence on sort of practice amount and if I could advise, because you often get asked that, and
Yes.
we get asked that at Brown a lot too. And so partly from your question and questions we get, I wrote a blog post on that. I have a blog with Psychology Today. So if you Google my
Mm,
name in Psychology Today, you can see an article on sort of the dose of meditation.
yes. And I'll
Um,
put a link to that
and,
below.
oh, sure. Yeah. Yeah. So, it's it's really variable in terms of what's recommended. So some meditation traditions are like, just start off with like 5 or 10 minutes a day and actually just, these baby steps in, and should be a certain amount of enjoyment of meditation. And if you're not enjoying it, you know, might not be the best thing to do.
Mm,
And then there's other approaches like say with MBSR where they're like, yeah, do 40 to 45 minutes a day. And if we ask big things of people, they often respond. And so then when we look at the data, if we see, like, there was the study by Sarah Lazar's group at Harvard where they randomized people to either, this was more of a yoga intervention, but to do either 40 minutes of practice a day, 10 minutes of practice a day, or they get to pick either 40 or 10 minutes.
mm,
And I thought the group that got to pick would do better in terms of stress reduction, but it was the group randomly assigned to get asked to do 40 minutes a day. And the other two groups actually didn't have a significant impact on stress. And so there is some evidence that a higher dose does work better. It's kind of like if I was learning how to play piano or something. If I practice
yes.
more, I'd probably get better at piano. But we can also, there's a lot of people who started off with piano and their teacher told them to practice a whole bunch, and they're like, started, didn't like it, and quit
Yeah.
because it was just burnout. It was just too much. It's not a good fit for me. If I got to do that much, forget about it. I'd rather do something else. And so for me, the first 10, 15 years of my meditation practice, I just meditated 10 or 15 minutes a day, and I got a long ways with that. It was a
Mm,
big benefit. And then maybe 15 years in or so, I took MBSR and, saw the encouragement to do 40, 45 minutes of practice a day. So I did that, and it ended up being a very good fit for me, and I've never gone back.
mm,
Um, but, I think as I wrote on that blog posting, I think the best, given the kind of lack of data on it, there haven't been many dosing studies. Probably the best person to advise you on the dose is yourself. And so, as Mahatma Gandhi said, wrote in his autobiography, I think it's called My Experiments with the Truth or something, or My Experiments with
mm.
Life. But he kind of led his life like a series of experiments where he would try something, and if it worked, he'd keep on doing it. If it didn't work, he'd stop doing it. And
Yes.
I kind of think of that with meditation
Mm,
practice of, if you do a particular amount of meditation practice, just try it maybe for 3 to 10 days of whatever it is, 10 minutes a day, and see how that feels. And then increase the dose for 3 to 10 days, see how that feels, or decrease the dose to 5 minutes. And then over time, you'll start to get a feeling of what's the best amount of time spent, but also what, there's sort of time, but there's also like quality or
mm.
content. And so
Right.
that's the whole other piece of what is your mindfulness practice about, and what are the contemplations that you're offering yourself. So sort of a mix between both the duration as well as like the content of the meditation to find that sweet spot of what's best for you individually at this particular moment in your life on this particular day, knowing it might be different tomorrow or next month or next year.
Mm. Such a distinction that you're naming about quality, because sometimes it becomes a to-do list, a check mark. How many more minutes? Almost, I got to whatever it is, a 40 or 45. And there's a sense of, okay, what is enjoying this investment, such an investment in our well-being. And
Mm-hmm.
the MBSR program, it begins right away, and it actually surprises people as they adapt to that length, that actually
Mm-hmm.
they're able to do it. And
Yeah.
what I've discovered is, I know for me, when I took the MBSR program, I was so busy with like work, just like, how am I gonna fit that in. And it
Mm-hmm.
made me investigate, what am I doing with my time even? So it became a
Mm-hmm.
bigger contemplation of, why do I think I can't? I'm busy, but what am I busy? What am I filling my time with?
Mm-hmm.
It's
Yeah.
right. So yeah,
Yeah, I think the average American watches something like 7 hours a day of like television related material. And
completely.
so for me, I find meditation actually saves me time. Uh, and because I fall asleep faster, for example. So there's an extra 20 minutes of my day there because I'm falling asleep about 20 minutes faster. But it also helps me make better decisions so that I'm less likely to, not like I remember when I was a faculty member at McGill, I had some grants from the Canadian Institutes of Health Research, and they were important. And I was, fresh out of my postdoc junior. I was working with some really important senior researchers in the field, and I would need to send some pretty important emails and that I cared a lot about. And sometimes I'd be there and it'd be like a strong emotion, partly excitement,
Yes.
partly feelings of anxiety. And I'd be like, okay, I'll go grab a cup of coffee and then I'll send that email. And so I'd go and get a cup of coffee, which would actually jack up my nerves even more. And I'd get back to my desk and I'll be like, okay, I'll send the email tomorrow, definitely tomorrow. And I'd just kick the can down the road. And through my meditation practice, one, I learned that coffee's not a good match for my personality. But two is, if a strong emotion comes up, can I just care for that emotion, understand its roots, care for those roots, and then do that skillful next step, which is often sending that really important email, which actually saves me time because I'm doing the most important thing, even if it's hard. And that allows me to live a bigger, fuller life that has greater impact and is a better match to who I am. So I do take, 30, 40 minutes a day to do meditation, but I think it actually is saving me time and increasing my impact because I'm making better decisions and better able to hold challenging things. But that's just me. It might be different for other people, and respecting whatever people's personal experience is with it.
So a couple more things I'm curious about, and we've talked about dosage, how much to meditate, and the other question that I get asked often is, well, is online as good as in person? And I know I've looked at some research, but so far shows it's equivalent. And, since the pandemic, it's really given opportunities of MBSR program for sharing it online, reaching more people. So I'm wondering, is there any new research around effectiveness online versus in person? Uh,
Yeah. Yeah, it's a good question. And it's something that's really pertinent right now, uh, just with the way society's going, not to mention the pandemic and stuff. I have seen very few, if any, clinical trials where they actually randomize participants to either get the in person or the online versions of a mindfulness program and then see the benefits. So those are, the best quality clinical trials if you actually have people that are up for doing it either way, so that they're very comparable participants and then just get randomly assigned to either get in person or online. So there's a real lack of data on that. But there are a lot of studies assessing the impacts of digitally delivered mindfulness programs, whether it's live online or asynchronous through an app or whatever. And also, there's a lot of studies for in person. We have a systematic review and meta analysis that combines
mm,
about 80 studies in young adults that's under review right now.
mm,
But we looked at just the effects on mental health and physical health in online delivered mindfulness programs and then also in live, like in person delivered ones. And
mm,
it was kind of interesting is when we just looked at it straight up, the in person programs were more effective than
mm,
the online delivered ones. But then when we started to statistically account for other variables,
mm,
um, what we were seeing is that often people with um, kind of worse health conditions were being provided the in-person programs,
Okay.
and people who were healthier were being offered the online programs. And so, if we statistically account for people's level of health at baseline, then
Mm,
the programs actually became equivalent in
okay.
their effects.
Interesting.
And so, the best analyses we could do, again, this is just summarizing a whole bunch of different papers
Yes.
that didn't randomize people to either online or in person, but the evidence so far from our analyses is suggesting that in person and online have pretty similar
Similar.
effectiveness,
Yeah.
um, but with the caveats that I just mentioned around the you know the need to do clinical trials where we're actually randomizing people to get one or the other to better understand it.
Yes. You're mentioning in that as well technology, and I know in your book you speak about technology and relation to technology and social media, and it's
Mm.
just this. I was talking to a friend of mine about. There was a time where I actually didn't have a cell. Like, I don't know if you remember the days where there were when the pagers came out, like, and that was the big thing at the
Mhm.
time. I had a pager when I went to university. When family needed to
Yeah,
reach me, they would page me. I go to like payphone, so
yeah,
life has changed. So I'm wondering if you can say a little bit about that. And I know you go more in detail, and I'll put the link to your book as well in the description below. But if you can share a little bit about that, and maybe this social
hmm,
media use, and a lot of people use it even not just throughout the day, but in bed before they go to sleep. So can you share a little
yeah.
bit about that? What you
Sure.
discovered?
Yeah. Yeah. And as I've had hundreds of young adults go through my mindfulness programs, and I interviewed a couple dozen when I wrote the book. And that was one thing that came up most often, is just kind of struggling with their relationship with digital media, screens, or social media. And it's something that's just up in society right now. And, I kind of think of it as through the lens of like tools that humans have developed over time.
Mhm.
And the tools that stand the test of time are the ones that have like a net benefit, whether it's, say, like a fish hook and a fish line. It's pretty effective to catch fish and feeds
Yes.
our families. And, there's a lot of pluses there. And then with, say, digital media or social media, it's a very new tool that we're still figuring out. And can we allow it ourselves to use it for where there's benefit? So say like a podcast or what we're doing here, it allows, I've been listening to a lot of podcasts when I drive, and it's allowing me to gain wisdom in a very scalable way. And
Yeah.
or during the pandemic, my 12-year-old daughters could connect with their grandparents in Victoria via Zoom
Mhm.
in a way that we weren't able to go to Canada for 2.5 years. And so to be able to connect with loved ones is such a powerful use of social media and digital media.
Mhm.
And then it also has its downsides,
Yeah.
potentially around addiction, and overuse, or like comparing our day-to-day lives with other people's kinds of best days. So often what people post on social media is sort of like their best moments. And can
Yes.
that allow us to compare ourselves to them, but we're actually just seeing a slice of their life. And there's money to be made from organizations on social media, digital media, advertising, all that kind of stuff. So can we use our mindful awareness to notice, say, when we're engaging with digital media or social media, is this the best use of my time right now? And so if I'm engaging in a Zoom call with my parents and my daughters, like, that's a good use of our time, and
Yes.
we're good. But if I'm like, doom scrolling through some kind of like
Not
social media
helpful.
platform, just lost in it, could I, actually be, connecting with my wife instead, or like
Right.
doing something that would be a benefit? So that's always a little check that I have of,
Yes.
is this helpful in this moment? If yes, keep doing it. And if no, can I let it go, knowing that there's pieces in play that have developed a lot of these digital tools that encourage us to kind of be attached to them, to keep using them, um, and know that there's causes and conditions that have gone into that. So we only have so much personal power to work with that. But I find mindfulness is actually a pretty helpful skill to, one, have the self-awareness of our thoughts, emotions,
Mm,
physical sensations on how that social media is making us feel, and two is to have the skills and attention control to be able to shift our attention
mm,
to something uh, that would be of greater benefit, if there is something else that would be of greater benefit, but our self-awareness will tell us that.
mm.
So that's how I tend to work with it personally,
Yeah,
and what comes up in the book and how I engage with others
as
around
you
it too.
mentioned it. This there's a it's not making it good, evil, or just it's the best thing on the planet. There's really what we do in the MBSR program as well is a nurturing. What is a relationship we have with social media? Are we using it to cover up things that we don't want to feel? And sometimes we need that.
Mm,
We need to distract, but is it helpful? And
yeah.
you're sharing this, it reminded me for me of quite a change that I made that I found so useful, which I used to, I had a habit of before going to bed. Oh, just check what's happening with sports, things like, just a little, almost like a treat. And it actually affected my sleep. So
Mm,
it's been years. I don't remember the last time I've done that, but for me, it's become a habit. There's no phone in bed, and my sleep has quite improved.
mm, mhm.
So this relationship again that you mentioned is how are we interacting with it,
Mhm.
examining it.
Yeah, yeah, sounds wise.
Yeah.
Yeah. Mm.
Anything else? I feel like we can chat for the whole day, and I really enjoy this conversation. And I'm
Yeah,
wondering anything
likewise.
else that you'd like the listeners to know in terms of your book or other ways that they can connect with you, areas.
Yeah. Yeah, I think if people are wanting to see more about what I'm up to, I'm on Twitter, like at Eric B. Loucks, and on Instagram, Facebook, and also have a website, ericloucksphd.com. So
Mm,
if you want to stay connected with some of the work that I'm doing, be happy to connect with you in those ways. So
mm.
thank you.
Thank you. And I'll link all of those at the bottom as well.
Okay. Yeah, sure. Yeah.
Thank
Sounds
you.
good.
Just
Yeah.
really
My
want to
pleasure.
thank you again for your time and generosity of heart. And, you bring both the heart and the mind, like deep heart
Mm,
connection, even can feel it through the screen, and really this deep knowledge in the
mm,
research, and so unbiased in your examination of the research. Like this is just what it is. So thank you again
mhm.
for your time. Thank you for sharing. If you found this useful, anyone watching, feel free to like, share, and subscribe if you haven't done so already. Thank you again. May your moments be filled with ease and may it bring you joy. Thank you.
Yeah. Yeah. Thank you. Yeah, it was a real pleasure being here. And I really appreciate all the work that you're doing to bring well being to your patients and to society as well through your mindfulness work and therapy as well. So thank you.
Mm. Thank you so much.